feel like when the patient can see their bacteria, understand it's an infection, and then go, oh, I've had an infection before. I've had to have an antibiotic before. Oh, sometimes my home care did have to change. Sometimes I did have to do something different at home. It
Mhm.
just brings it more into this is healthcare.
It really does. It's just one of those times when a picture really is worth 1,000 words, or
Yeah.
even like a video, because they walk up to the screen. They don't have to put their eyes up to the microscope. This
Yep.
is on a giant TV screen, and they can see the bacteria swimming around, and you can show them this is a white blood cell. Oh, and you see how the bacteria are attacking your white blood cells. All of a sudden, you didn't say very many words, but they know they
Yep.
have an infection in their gums, and everything changes once they understand that.
It does. It absolutely does. It does. I just find that patients are so much more willing to do whatever it is that we're asking them to do at home. And we could have the best tools and technologies, but if our patients are not a cooperative part of that, we're going to
Mhm.
struggle to keep them healthy. We're going to struggle to even get them healthy. And
Mhm.
then they end up looking at us going, well, I came in and I did everything that you told me to do. I did the therapy that you recommended. And it's like, well, what about that home care piece here?
Yes.
How did that go? Because this is a coordinated event between you, between me. I can't do it all. I mean, I always used to tell my patients, if I see you 4 times a year, there's 365 days a year. Those those other days that you're not seeing me, what are you willing to do?
Yeah.
Because that's gonna be a big part of getting you healthy.
Absolutely. And when they see the bacteria swimming around, all of a sudden they have like a more emotional reason to change their own behavior. So a lot of times these days when we're showing the patients their plaque, and then we might, propose care, sometimes they'll say, well, can I go home and work on this on my own first? And I'm like, absolutely. Because that means that I've generated some change where I've seen someone be like, we've just been monitoring their illness for all these years. And if they're excited to go home and make some changes before we decide if we're doing care in the office or not, yes, please. It turns my role into a much more satisfying, impactful situation where I actually am making a difference.